Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to Asnurhanna. I am Asnurhanna binti Saleh, BMHS student, semester January year 2022. My practicum placement was at Emergency Department of Hospital Al-Gajah Melaka, and I will present a case study regarding snake bite management for my NBCP 2626 clinical practice of trauma and emergency care. Okay, there are two types of snake, which are venomous and non-venomous, and around 140 species of snake available in Malaysia. Only 17 of them are venomous, and most common venomous snake in Malaysia is known as viper, cobra and krait. The venom can be divided into three categories, which are neurotoxic, hemotoxic and cytotoxic. Actually, most of the snake bites is for their self-defense. Not all injected the venom. For the snake bite sign and symptom, it may vary depending on several factors, which are type and size of the snake, amount of venom injection, the number of bites, site of bite and size of the victim, time interval of receiving treatment. And it can be classified into 4 categories, which is mild, moderate, severe and very severe. For mild, the symptom is no pain to moderate pain, erythema, edema 2.5 cm to 15 cm, and no systemic symptom. For moderate, severe pain, tenderness, edema 25 to 40 cm, spreading erythema, petechiae, vomiting, fever and weakness. For severe, widespread pain, edema 40 to 50 cm, ecchymosis and systemic sign can be seen. For very severe symptoms, the patient will develop rapid swelling, ecchymosis, central nervous system symptoms, visual disturbance, sometimes can be blurred vision, sometimes can be ptosis, shock and convulsion. Specific treatment for snake bite management is anti-snake venom. It is so expensive. The dosage given is depending on the severity, and it will be given intravenously via injection or infusion 2 ml per minute, and it is best effective when administered within 24 hours and should not be given locally. For the mild condition, the amount of anti-snake venom will be given is only 5 vial. Moderate and severe is 5 to 10 and 10 to 20 vial respectively. Move on to the case scenario discussion. My patient, Mr. M, male, 35 years old, Malay, came to emergency department on 10 of March 2022 at 2:30 p.m. He is weight 92 kg and his height is 172 cm. Mr. M was presented at the emergency department alone and complaining of his right dorsum hand was bitten by a snake today at home. He claimed that the snake bite happened while he is trying to open the door to get into the house. He claimed that the snake was already at the window trying to enter his house. He was trying to get rid of the snake with his torchlight using his right hand. So the scene was happened about 20 minutes before he presented at the emergency department today. And he brought together the snake with him as he was advised before by the paramedic via phone call prior to his arrival on the emergency department. the snake was already died on arrival. He claimed he was bitten 2 times because he was struggling to kill the snake. On arrival, patient was alert, conscious, able to walk, able to talk full sentences, and oriented to time and place. His right wrist was tied by a cloth about 4 centimeter above from the bitten area, until 4 centimeters, and he was able to move his fingers, and the periphery was warm with CRT is less than 2 seconds. He has been triaged to the red zone after discussing this situation with the medical officers for close monitoring. This is because we don't know what type of the snake yet, whether it is venomous or non-venomous snake. Mr. M is a known case of hypertension for the past 2 years and under KK Alur Gajah follow-up. And he has undergone appendectomy at 10 years old. His medication is tablet losartan 100 mg per day. No known drug allergies, no known food allergies. He was married with 3 kids, smoker, 2 packs per day, not abusing drugs, not consuming alcohol. On examination, he was alert, conscious and oriented, able to give the whole history about the snake bite. He looked agitated and perspiring, maybe because he is concerned about the snake bite. And his right hand was tied with a cloth at around 4 cm above the bitten area. The pain score at that time was 4/10. He complained of dizziness and headache post-snake bite. Primary survey was done, and the airway was so patterned, no slurred speech, breathing was good, SpO2 100%, respiratory rate was 22 per minute, the circulation, good pulse volume, the pulse rate of 111 beats per minute, BP 189/100, temperature 36.8, and the peripheral was warm. During my interview, the patient claimed that he is not yet taken his antihypertensive drugs today. Okay, GCS was full, 15/15, no blurred vision and no ptosis seen. Extremities, all other limbs are in good condition except for the right dorsum of hand. At the right dorsum hand, can be seen 2 bite marks apart in 3 cm circumference. So here, a part of 3 cm circumference, there are 2 bite marks. No bleeding, no swelling, only a scratches. Dikeliling tu ada scratches, mild erythema and CRT less than 2 seconds. Radial pulse artery was good. Then we carry out investigations. ECG looks normal, sinus rhythm, no ischemic changes, full blood count, all parameters are normal. For coagulation profile, normal coagulation profile, INR is 1.1. Renal profile was good, CK not elevated, ABG no acidosis, no alkalosis, and the 20-minute whole blood clotting test is normal. The blood that we will withdraw from the patient and we leave it on a clear glass, after 20 minutes it is clotted, and we send this patient to the x-ray to see if there is any foreign body. Foreign body here is we can see is if there are any venom infiltrate below the skin, so there is no foreign body seen. So the impression of this case is Snake bite by Lycodon species, non-venomous, with mild symptom of envenomation. So we confirm that the snake brought by the patient is from the Lycodon species, also known as ular sampah by the local. Other differential diagnosis is anaphylactic shock, extremities vascular trauma, septic shock, serum sickness, wound infection, or scorpion envenomation. The management of these cases can be divided into 3 phases. The phase is the first aid management when the patient presented at the triage counter. Then he was triaged to the red zone for close monitoring until it is proven that the type of snake that bite him is a non-venomous snake. He was down triaged to the yellow zone for observation before discharge home. At the triage counter, the triage officer reassured the patient by soothing him. It is critical to calm the patient before proceeding with any intervention in order to instill trust in him. The removal of the tight cloth over the bitten hand was done immediately. The restriction of superficial blood flow prevents the venom from spreading, exactly what you don't want to occur. Actually, venom that remains concentrated near the bite destroys cells quickly, and allowing it to disperse dilutes the poison and likely reduce tissue damage. A spleen and a crepe bandage were used to immobilize the right hand from the bite location upwards. Okay, the compression bandage is firm enough to restrict lymphatic movement but not the blood flow, and its function is to delay venom absorption in the system, not to restrict the blood flow. Patient then was triaged to the red zone, and at the red zone the patient is laid down and vital signs are checked. A large bore granula was inserted at his left dorsum hand. History taking was done by the medical officer. The bite location was examined meticulously. The biting site was marked with a small micropore to see how the erythema goes, how the erythema progress, and if there is any swollen letter. The hand was placed at the same level of the heart, not elevated. So medication are served as ordered. 0.5 mils of IM ATT injection. Tablet paracetamol was given as the painkiller, and tablet losartan 100 mg as it is his medication of antihypertensive. Other investigation are carried out, and the patient's symptoms are monitored so closely. ECG lead was placed and attached to the chest continuously to see if there were any ischemic changes or any abnormal rhythms, but there are no abnormal rhythms happen. While waiting for the investigation results to ready, the patient is rest in bed. Pictures of the snake that brought by the patient earlier was taken and shared to the medical specialist on call at Hospital Melaka for confirmation of the type of snake, and it confirmed that the snake is non-venomous Lycodon species. After all, the results show that he was not in danger. The patient was down triaged to the yellow zone for observation. There was no indication of giving the anti-snake venom for this patient. At yellow zone, patient is laid down on his bed comfortably. Pain score is revised and it is 0/10. His blood pressure was repeated 132/80 and the pulse rate of 78 beats per minute. The right dorsum hand that has been bitten by the snake is not the erythema is not extensive from the initial mark and no swelling seen. Patient was planned for discharge by the medical officer with tablet paracetamol 1 gram per day as per needed lah. Before discharge, some useful advice was given to him to educate him on the first aid of snake bite management in case if it happens again in the future. He was advised to stay calm and leave the snake unthreatened because most of the snake, they bite for their self-defense. And it is not permissible to apply a tourniquet to the bite site or to suck or incise the bitten region. And get to the hospital as soon as possible. Then inform the doctor of any symptom develops. And make sure to recognize the snake straight and if possible, bring the snakes together. Okay, now let me share about the first aid management of snake bite. It is around the mnemonic of do it right, RIGHT. So reassure the patient, keep the patient calm and do not panic. I is for immobilization. Immobilize the limb or area as same way as fractured limb. And do not apply any tourniquet or any pressure. Only use bandage just to hold the spleen, not too tight. Then get to the hospital immediately. Do not use any traditional remedies as it has no proven benefit in treating snake bite. Do not suck or incise over the bite area. And tell the doctors or any systemic symptoms that manifest on the way to the hospital. Finally, a non-venomous snake bite patient can be safely discharged if the snake can be positively identified as a non-venomous species by a trained expert. The clinical condition of the patient correlates with the expected effects of the bite from the identified snake species, and the bite did not cause any significant tissue injuries such as laceration or persistent bleeding that may need further treatment. So that's the end of my presentation about the snake bite management, and I would like to thank you, Asnurhanna, for teaching us the emergency and trauma care for this semester. And Salam Ramadan and happy Hari Raya in advance. Thank you, sir. Assalamualaikum.